Okay, I think we'll get things moving here. For those that have joined, good morning. Welcome again to our Design and Construction Market Outlook. We have quite a few speakers on today. AEI, Affiliated Engineers, has joined us. They have a great presentation to go through today. So we have Keith Garrett, Fred Betts, and Andrew Jones. We have Kevin Moses from Big State, electrical contractor, Richard Vermeulen, our co-CEO, and myself, Blair Tennant, associate principal. A couple logistics before we get going. We're going to ask everyone to please mute their microphones if they're not speaking. We love to see everyone, but just for the bandwidth, we're going to have everyone keep their camera function off. Interim questions, just please use the chat feature. We're going to pause a few times throughout to take questions, so post them in the chat if you'd like. A reminder that following this session, we're going to, along with a thank you, send out the slide deck along with an audio link. And next week, we'll follow up with what we call the situation report. It's a summary of the information discussed, just in case you missed it or want to pass it along. And a reminder, we're moving to monthly sessions. So given the first Friday of January is the 1st, we're going to shift that to the 8th. So we will be on again on January 8th. As I mentioned, we're going to start with AEI. Their presentation is called Breaking the Chain, Lessons Learned from COVID-19. We've got subcontractor feedback on the electrical side, as well as some mechanical information. And then Richard is going to take us through kind of a preview of something we're working on, total benefit, the built environment, with a focus on health networks. So with that, I will pass control over to Andrew Jones, and he can start taking you through AEI's conversation.
Okay, thanks, Blair. This is Keith Garrett. I'm the Managing Director of AEI's newest office in Boston. I'll introduce the rest of the team in AEI a little bit here in a minute. You want to go to the next slide, Andrew? What we wanted to do today was run through a quick agenda. We've been actively engaged with clients in many market sectors, providing solutions for COVID, really going back to March. And we've tried and seen many different solutions implemented with varying degrees of success. And recently, our current approaches are really based on the science of COVID and our understanding of the transmission of infectious diseases like this. So we want to start there with this presentation, just sort of lay a groundwork of the science and then move into the solutions and simple physical solutions, and then to the part that I find really exciting, which are some digital solutions that we're calling smart building solutions. So for those of you who don't know Affiliated Engineers, we're a national scale MEP firm. 18 offices in the US and one in the UK. And like I said, Boston is the newest office, opening in September, which is where I'm located. You can see a lot of services, and we cover a lot of markets. And I think the firm is, and the practice is really built on the top 4 there in the market list. So science and technology, and we break that down a little bit. We tend to do that for corporate and developer clients, for federal government clients, and then a lot of higher education and campus work in science and tech, healthcare, energy and utilities, and commissioning. So those are the fundamental basis of the company, and a lot of emerging practices and market areas that you see on this list. And we're going to touch on some things from a couple of those as we go throughout the presentation. So again, my name's Keith Garrett. I'm the Managing Director of the new office in Boston. I'm joined today by Andrew Jones and Fred Betts. Andrew's a project manager in our healthcare practice and an intelligence building market leader for us. And Fred's active in our building performance practice. And I think it's important to know that he also is currently leading ventilation-related research funded by ASHRAE, ASHE, and FGI. And the two, Andrew and Fred together, often consult sort of at the intersection of high acuity healthcare environments and energy efficiency. So with that, I'll turn it over to Fred.
All right, thank you. So I apologize right away for the morning dosage of science here, but we're going to spend some time on the science of COVID just because it'll inform the decisions. So so a lot of the recommendations we're making in the latter half of the presentation will have some basis in fact. This was called the novel coronavirus originally, novel meaning new and unique. And a lot of folks just, and again, it was February, March, and we were scrambling and just threw a whole bunch of previous the previously thought of solutions at it in the hopes that something would stick, and we got mixed results. I don't think anyone's going to argue with that. But we're still seeing that actually today. 10 months later, we're still getting products promoted, solutions promoted that don't necessarily offer a real solution. And largely because a lot of folks are not taking the time to really define the problems. That's what we're going to do in the first couple of slides here, returning to the basics of infection prevention. Next slide, please. So some of you may have seen a graphic like this. There's a lot of variations on this, but it's the infection chain. And the goal of the infection chain is to find a mechanism to break a link here so the pathogenic organism, in the case of today's discussion, SARS-CoV-2, doesn't get passed from person to person. And this structure here will work actually for any, we use this for Ebola, we use this for influenza, and so on. Any pathogen will fit in this structure. So let's characterize SARS-CoV-2. I think this is a click through, yeah. So it's a very small pathogen, and we're going to get to size because it definitely has a significant impact on the solutions that we make. The reservoir and source. Reservoir is a place where something can grow. Source is a place where you can be infected from. So the air has been shown to be a source. Surfaces have been shown to be a source. The pathogen predominantly grows in our respiratory tract. And so there's various ways of addressing that. A vaccine would be great, and those theoretically are coming here for mainstream usage. But predominantly we've been looking at surface and air cleaning for the last several years, or several months. Means of escape, how does this get out of the current host and go on its way to another person is breathing, coughing, sneezing. And that's literally why we're telling everyone to wear masks, because it'll knock that down. It does not fully prevent it, but it does knock it down. And you'll see that's kind of a theme throughout here. Mode of transmission, it can be direct contact, indirect contact. And this is one of the things that was a little controversial, and we'll get into that, airborne dispersal. And this is, again, why we say we should social distance, so you're not near people. That's why we're doing surface cleaning, and airflow management is something also we're going to talk about at length here. Means of entry is predominantly the mouth and nose. I mean, technically it can get through in through the eyes, but that requires a surface contact vector, which is, again, a little bit less so than the air. And I differentiate here between masks and N95 masks. These are a higher grade mask that will offer additional protection. Again, it's not 100% foolproof, but it'll help. And then host susceptibility. This is has been one of the biggest challenges, in that you can get this disease more than once. We're fairly sure it'll last 2 to 3 months. There's some evidence that your immunity will last for 6 months, or if we finally get that vaccine. So it kind of gives you the lay of the land as to what we're doing. So let's start right when means of escape here. The pathogen has now left your mouth, your nose, and it's since our bodies are full of water, our breath is very moist. Those pathogens and whatever else is in our airstream usually encapsulated in the water, and that water is the dominant amount of mass for that, and that's why you see that social distancing requirement, and the 6 feet, because that's how much time it takes gravity to pull out the large and small infectious droplets. The droplet nuclei is what was the big controversy of, is this airborne or not? Do we have droplet nuclei that can infect people? It seems the answer is yes, although we're not 100% consensus on that. The evidence definitely supports that this is an airborne spread, and it's done through these droplet nuclei. So just social distancing by itself won't handle that. So as I mentioned, we're going to start talking about size a little bit. Towards the bottom here, if you click, Andrew, I think we highlighted it, is our target virus today, coronavirus. Let me stop and talk on the chart here for a second. On the left, on the y-axis, the left axis, is the size of these various pathogens. On the x-axis is filter efficiency. And on those colored lines is the efficiency of those filters. And those filter efficiencies vary based on the size that they're picking up. So the size of what we're trying to stop very much matters. To make this even more complicated, next click please, is that the size changes over time. So like I mentioned, as it's leaving your mouth, it's encapsulated in water. The size will be somewhere probably between a half micron and a micron and a half. And then as it dries and turns into a droplet nuclei, it'll shrink down. And so where it is in its life cycle, or in its life cycle through your building, has an impact on how effective filtration is. So when it's leaving your body, it's a larger size. So this image here comes from our friend Travis English. He's chief engineer at Kaiser Permanente, and what we're terming the COVID cloud, or the SARS-CoV-2 cloud, of high levels of pathogen, and then which is an immediate area, and then the pathogen, as we showed, kind of dissipates and evens out, but it's still floating around. And what we're showing is this is really a room level problem. So you can do a simple dilution calculation. The contamination coming from the person on the left, that gets sucked up into the HVAC system, and it gets diluted with all the other air that's getting sucked up by the HVAC system and gets filtered out at the air handling unit. By the time that comes back, you've removed 95, 99, depending on how big your HVAC system is, % of the pathogen. It's pretty much ineffective. So what's happening at the system level really doesn't have a huge impact. It's really, our focus needs to be what's happening below the ceiling, in the spaces where people are infected and can potentially affect other folks.
Well, thanks, Fred. I appreciate the dive into the science. And I know that's probably a pretty hefty subject to go through so early in the presentation, but it's really critical. We have to know how something like COVID-19 or SARS-CoV-2 transmits before we can really develop accurate and meaningful solutions. So now that we've taken a step back to the science, what did we learn through this year? What have we seen? What are our takeaways, and how do we apply those to our current situation, but those in the future? So we know now that like any transmissible disease, we have to break the chain. We have to develop solutions that are based in science and really understand how can we remove vectors of transmission. Surface transmission is not as large as we originally thought. It's not necessarily like influenza, but more aligned to the previous SARS outbreak. As Fred has alluded to, the HVAC system doesn't necessarily spread COVID-19 or infectious particles in a meaningful quantity, but that airflow direction of that system does matter, and we'll dive into that in a little greater detail later. The Swiss cheese methodology is one that I really appreciate. We're in a situation right now where there's not one meaningful or all-encompassing prevention measure, or one that's totally capable of preventing community spread. But when we start to layer on our infection prevention measures, we reduce the overall likelihood. So layering on meaningful measures helps prevent that transmission. And then one item that is very industry specific is healthcare services. We've all seen what the inability to provide general care to the population has done this year. One for care in those environments, but then two, revenue and how that's generated for our healthcare institutions. And we hit the brakes earlier this year. A lot of our hospital networks did, and they're still reeling from those effects. So let's talk about a real world example of how we can prevent that specific instance. So AEI is involved in a project, a 12-story high acuity tower, an ICU bed tower, that's in the middle of design. And we were in the middle of the design earlier this year, and the owner said, all right, what am I learning from other institutions out in the world? What am I seeing? And are there any things that I can adapt for this building right now? And so they took a pivot and they said, all right, I want to have a new goal. I want this building to be able to provide care for a surge population and isolation population if necessary, but keep the remainder of the building open, keep those revenue generating services going, keep the ability to provide care to my general population available. So how do I do that? So there was this large planning exercise, and it involved the architect and engineer and clinicians and facility managers and a lot of really smart individuals. And they decided, all right, let's dedicate 2 floors of this building to what they're calling a respiratory isolation or a surge floor. And to tell you what that really means, it was an exercise in planning. They had the confines of a physical building already developed. They knew that they couldn't go outside of a floor plate, that they had to develop a solution that fit within that structure. So what they did is some really meaningful but small changes, some small pivots. The general floor layout is the same from all the others to standardize. But they added some vestibules where necessary to monitor patients and dedicated or flexible donning and doffing spaces. They dedicated elevator flows when necessary to these top floors, so they're not intermingling patient flows for transmissible diseases and the general population. One of the larger items that they had to invest in or investigate further was a negative pressure isolation and exhaust system, the ability to evacuate the air of that floor and bring in fresh air. But that's the case for just 2 floors, not the entirety of the building. And this is an ICU tower. So as we know, code minimum is already much more stringent than a general patient care bed. So there's a minimal growth in the electrical need at the head wall, but there is a small infrastructure upsizing of our medical gas system, our med air, our suction, our oxygen. And that was not necessarily that one individual needs to consume more air while they have a respiratory illness, but the ability to double up occupancy in a single bed in case it's absolutely necessary. That ability to plan for a surge population and provide additional care in the 50 beds on each floor, they can provide now care for 100 for each floor. So that's a built environment example of taking the science and applying it to the real world. But we also have to think, the infrastructure and the investment, the construction of that only goes so far. It's really about human behaviors and how can we modify those. And here's an example of a bunch of folks in a cafeteria, and someday we'll get back to the ability to do this. But if you provide all of the investments in infrastructure available to you, all those resources, those are meaningless the moment that a bunch of folks sit around a table to have lunch, they take off their mask and they start talking to each other. You've just ruined all those other mitigation efforts because you're transmitting the disease now through just community from getting together and talking at a lunch table. So let's talk about an office space. What are some simple solutions that we can modify our occupants' behavior, but then also prevent spread? So if you're sitting down in an open office environment now with low cube walls, we understand that for COVID-19, people breathing on each other is extremely undesirable. That's how you spread. So how do we prevent that? We know that an HVAC system might not spread through other spaces. It might not go through the overall system, but it can push towards other people, a COVID-19 plume of infectious particles. We've seen this in multiple case studies. One that everyone might recognize is that of the restaurant in China. And so what's a simple solution? Partition walls, the ability to block that airflow onto your cube mate. Now that's a certain height. We want to take that tight to the ceiling. We want airflow to be able to bring in that COVID plume and take it away through the ventilation system. But we don't want it tight to the ceiling, so we're creating stagnant pockets of SARS-CoV-2 buildup. Another idea that we can implement in the future is a strategic placement of diffusers, supply and return grills. Not necessarily a growth in overall air that we're delivering to a space, but being mindful of how that airflow travels across other occupants of the office space. And we're saying here that ASHRAE 62.1 is still extremely viable for ventilation rates in this instance, but we just want to make sure we're not blowing air on our other occupants. Now, what about smart or digital systems that we can leverage? So AEI is also taking part in a few projects prior to COVID-19 where we're building occupant experience applications. So you as an employee of a large scale commercial office building, you go into your office each day and you're using your cell phone. So why not integrate that into the built environment? So you walk up to your elevator, you get a security code, you scan it in, it takes you up to your floor, you book a desk for your hoteling office space, and you have the ability to control the built environment of the lights and the temperature. So that's something that's a solution that's already in place today and being developed. But how can we pivot that to help modify those behaviors? What if I get my security code, access code each day? When I do that, it automatically pops up, what are my COVID-19 protocols that I need to be reminded of? Wearing a mask and keeping 6 feet apart and making sure that you're washing your hands at a meaningful interval. Also, what if we have dedicated flows throughout a space, wayfinding to making sure that I'm not going in the wrong direction? Or I have the ability to book a workspace that's appropriately spaced out from my cube mates, that I'm keeping that proper distance. That's helpful for our users, but it's also helpful for us as building owners. It generates usable data. It helps us determine right time cleaning and sanitization services to dispatch those. It also helps with contact tracing, knowing who was in the space for how long and whom they might have come in contact to. It also helps us understand, are too many people in one space at a time? And we call out the Wells-Riley equation, which is something we'll briefly talk about here soon. We can also use these smart solutions on our systems. I say here a fault detection. This is a cartoon graphic of a fault detection system. We can also write rules and alarms in our building automation systems to say, am I delivering enough outside air to a space? Do I have a damper that slipped off an actuator and therefore it's not working at all? Am I having a system that has gone down? Can I alarm our facility managers and technicians and be able to dispatch them to correct these issues in a really quick time frame, to making sure that we're not putting our occupants at any additional transmission spread. So how can I merge these systems, this real-time data of occupant analytics and then my fault detection or my building automation system? So there's the Wells-Riley equation, which is a more general equation or formula on the probability of airborne infections. There's a bunch of variables to it, but it really revolves around what is the action that someone's doing or people are doing, how long are they in contact with each other. So, and that creates a probability of transmission or community spread. And so if I know that through occupant analytics that I have a certain quantity of individuals in a conference room, they're more than likely talking, I can start a clock and say, all right, they're there for 30 seconds, 5 minutes, 30 minutes. I can create an alarm or a rule and warn those individuals or warn someone, a compliance officer, and say, all right, we've got folks that are in too close of contact. The likelihood that they are spreading the virus at this point is likely. And so we can use these systems and integrate this real-time data to help us reduce transmission as much as we possibly can and influence those behaviors. So we've gone through a lot of really meaty science and a lot of solutions pretty quickly, but we want to remind everyone that anytime that we develop something or really think of a possible solution to prevent any spread of COVID-19 or any future outbreak, or we look back at old outbreaks in the last 10 to 20 years, it's all about breaking the chain of infection prevention, understanding what is your source, how does it escape, how does it transmit, how does it enter your body, making sure that we know that science and how we can break those, we can Swiss cheese layer solutions to have a meaningful reduction of transmission. And so I want to thank Vermeulen's for having us today and having us give us the ability to talk through this. And Blair, I think we wanted to transition to some questions at this point.
Yeah, thank you so much to the AEI team. That was fantastic information. We'll talk to Daniel. Do we have any questions from the audience?
Not at the moment, no.
Okay. So one of the things I was curious about, and in the beginning of this pandemic, and I think, past pandemics or outbreaks, a lot of focus gets put on, modifying ventilation air, exchange rates, upping volumes, removing energy recovery, etc. The take I kind of got from this talk was that's not a major issue and perhaps not something you should be investing your dollars in.
Yeah, that's correct. So I was, in the room or knew people in the room when we were in March and we were scrambling. So I can tell you why we did 100% outside air and why we told people to shut off wheels. And it's because it was easy and it was likely to help. And there was very little cost. With the timing of having this happen in March, you're generally across the entire United States, you're fully in economizer season. And so there was very little burden, relatively speaking, on HVAC operators to implement those changes. And if it happened to turn out to be the right thing, great, wonderful. We've helped solve this problem. There was very little downside and a lot of potential upside. We know now that that's not exactly how it's transmitting. And so as we're now getting into the colder months, there is going to be obviously over summer there was too. There is an impact both in system capacity and then also in the financial bottom line of energy impact of running excess outside air. And so really, there isn't a lot of benefit. It was a low cost, quick thing we could do in March, but now we kind of know better that having really high end filtration, a MERV 13 versus a HEPA filter in your air handling unit, it's nearly identical. You get very much diminishing returns after MERV 13. And it's again because that I think I kind of glossed over that during my part of the talk of the virus actually gets larger again as it bumps into various other particles in the room, and by the time it makes it back up into the HVAC system, it's large enough again that it does get caught in most filters. Also, it's deactivating over time. So out of 300 outbreaks or super spreader events studied by the CDC, none have been tied to transmission via the HVAC system through the air handling unit. There definitely is a bunch of evidence for spread based on air currents inside the building. So that's really what we need to be managing again for this pathogen here. But yeah, I'm glad you asked that question because it's brought up. I see mainstream media still pumping that stuff out, and we've kind of figured this out in July, August that 100% outside air really is just a non-factor that's still being touted as a solution, and it really won't. That does nothing. It's just there's other places you should be spending your money first.
Well, and with that, are you seeing clients investing in kind of revised, air distribution layouts like you showed there for an office setting? Is that something that's going into designs now and maybe going into retrofits?
Into designs, yes. Into retrofits, not so much yet, because at least me personally, I'm sure others maybe have seen something, but getting up into the ceiling and tearing out all your ductwork and rearranging it's not a simple change. The partition walls and the like that has definitely been being done quite frequently. But
right.
Is there any difference between underfloor air and ceiling systems?
Do we have another hour to talk about that? Yes, there is some evidence there to demonstrate that underfloor air distribution systems are better than a mixed overhead system for reducing disease transmission, not just for SARS-CoV-2, but for others. So yeah, it is better. Whether there's, I don't know if we have solid science to say how much better in order to inform a cost-benefit analysis specifically, but yeah, the solution is definitely better. Obviously, comes with baggage.
Thanks for kicking that back to us. That's great.
Yeah, no, I mean, there's the cost side, but then also determining the benefit side is equally, if not more so, challenging. Because really, again, I'm trying to do this quickly and with minimal scientific pain, but it's how the seating arrangement is done and where the diffusers are placed and so on. It's quite the process to get it laid out in such a way that you're isolating airflow patterns within the space.
Guys, Keith, Andrew, Fred, thank you so much. If you can hold on, we might have some more questions at the end, but right now let's shift over to Kevin with Big State. Just kind of tell us what he's been seeing in the electrical market lately.
Yeah, thanks, Blair. For those of you who don't know who we are a commercial, industrial, and service-oriented electrical contractor in Texas. We employ roughly 700 electricians between San Antonio, Austin, Houston, Central Texas, and the Valley, Gulf Coast. So Blair and I have been connecting over last several months, I guess, Blair, since March when this thing started, to discuss, some impacts to us from a subcontractor perspective, which the three topics we've been tracking is current work plans in place for Big State Electric, effect on current and future work, and effect on costs, which is the most important thing to us. So let me make sure, hit the down button. There we go. One too many. So regarding current work plans in place, our staff internally in the offices is back at 100%. We went to a remote status or a partial remote status back in June, and that lasted for a couple months, but we're back 100%. We're masked up. Everybody's masked up. Lots of Teams meetings, lots of Zoom meetings. One thing it's done is it's forced us to communicate better. So we're being better at we're getting better at communicating. It's forcing us to plan better, and so there is some advantages to believe it or not, that's helped strengthen our staff internally. We are getting hit little by little by COVID, with COVID cases. Recently, we had 7 in our prefab shop, and in San Antonio, we're up to about 20 to 30 in the field that have been diagnosed or tested positive for COVID. One good thing is furloughs down 50% for us, but it's still an impact. And 15% of our workforce is in quarantine due to exposure. So this is an interesting impact to us because it's nothing you can plan for. We get a call on a Monday morning and we've got 14 people in a hospital working, and one guy test positive. We had to send 14 people home for 2 weeks. So it's very unplanned. It's hurting work schedules. It's creating animosity between our clients and us. But at the end of the day, what can you do about it, right? Some job sites are different than others. Our internal policy is for people to test negative 2 times and come on back. However, like I mentioned before, some job sites require a 14-day quarantine due to exposure. So this is interesting because we could be we're doing a large courthouse downtown San Antonio, and one of the painters were tested positive, and I had 2 electricians that were in the electrical room while he was painting, and we had to send those guys home for 14 days. And the painter showed up on another one of our jobs the next day that didn't have near the amount of administrative tracing or policies in place to monitor. So these guys it's kind of an interesting situation where people want to get paid, so if they test positive or around somebody that tests positive but they can move to another job, it's impacting us as a trade partner. We're still going through daily screening on job sites, just simple administrative tasks that take about 30 minutes potentially a day on the job site away from our productivity. And still with productivity measurements, 7 to 10% lost time on projects. which, that could be for vertical transportation, allowing 5 people in the personnel hoist versus 15 to 20 people. Effects on current work and future work. Tracking back to last quarter, September bids were good. We tracked some AIA billings back in April that were down, and we were really concerned with October, November, December. And in November, when October hit, we saw a drastic decline in the amount of bid opportunities for us. We were like, uh-oh, here we go. But luckily, November picked back up. It was a pretty impressive month for us, about $90 million worth of bid opportunities. And we're projecting $70 million in December, which is good, considering the holidays are usually a little more stagnant. I haven't seen a lot for January come up and coming. When we see RFPs, it's interesting. The bid durations, the durations between us receiving an RFP, and I don't know if this has anything to do with COVID, but when we see an RFP, we're seeing tight deadlines, 8 to 10 day deadlines versus maybe a 14 to 15 day deadline to turn over pricing. Austin's nuts right now for anybody that knows. The workforce is at its potential. And our sales in Austin, believe it or not, are up 73% for 2020. So we're excited about that. I mentioned a little bit about the AIA billings down in April. We thought we were going to see a lull in October, November. We saw it in October. We were very nervous. However, November and December picked back up. Market momentum is steady for us in Texas, Central Texas specifically. And crews seem to be more comfortable working on job sites. I think it means they're more comfortable. However, I tend to think that it's potentially a numbness to what's going on. Most of the work that we're seeing from a bid perspective is distribution. For those that don't know, Amazon is investing a ton of money into the market. Mission critical, which makes sense with all the remote learning and remote, the online shopping and some of the remote storage opportunities, and manufacturing. Manufacturing's starting to increase a little bit. Service opportunities for new installations of COVID-19 mitigation systems. So that goes a little bit with what AEI was talking about. We're not necessarily seeing it from a service perspective, but we are seeing some betterment pricing opportunities for new projects. And last but not least, the effect on cost. There is an effect on cost lately. PVC is up 300%. I don't know why. I mean, they're saying due to the hurricanes and the lack of resin, but 300%, and the amount of shortages from the PVC is astronomical. We're having about a 40% increase in lead times for high voltage and medium voltage systems, switchgear, pad mount transformers and substations. And any of the developers and contractors on the line might think, hey, we don't have any of that. Well, yes, you do. You're going to have it, and potentially at the utility level, which can impact your power on dates on projects. Other material shortages are residential breakers and busway systems. Stored materials. I've been keeping this one on the radar pretty heavily. When you can get stuff submitted and you can get stuff ordered and you can get stuff in town where you can control it and store it near your projects, it's advantageous. Copper's going up. It has been going up. It's pretty high right now. Consider on projects, if you're in a budget crunch, some aluminum solutions. It's gone up a little bit, but it's a heck of a lot more steady. And we mentioned about Schedule 40 and Schedule 80 PVC. They're not even making half sizes right now. So those of you who are designers, consider your riser diagrams or underground infrastructure to be in whole sizes. Daily screening for crew members. Again, this is something that I've kept on the agenda, and it's pretty astronomical for us because this is something that we really haven't tracked extensively, but for 700 employees, 600 to 700 employees at 45 minutes a day is a $20,000 a day loss in margin. We are starting to put added impacts in our change orders. So that's something that's new, Blair. And keeping our core workforce during this COVID stuff is we're able to keep them busy through 2021, so we're excited about that. I don't know anything about what 2022 has in place, but 2021 is looking pretty good. And the potential for factory backlog and increased cost due to high demand with some of these mission critical projects and some of these Amazon projects that are coming in, the demand for materials is going to be high. The demand for labor force is going to be high because the schedules are probably 50% more aggressive than they typically would be. And for whatever reason, they just want to get this stuff in, get it up and open up and start production. So that's all I got. This is us in Vermilion's tracking these three topics over the last couple months, and that's our update. So happy to take any questions at the end of this deal.
Kevin, thank you so much. I'm just going to quickly go over some bullet points from DSI. They're very similar, large mechanical contractor in a similar region, and then we'll pause for a second for questions. But you know what DSI is saying is pretty similar. They're focused a bit more on the metals, a lot of the piping, carbon steel moving. He's saying aluminum in addition to copper moving, but what he's saying is the imported metals market is still soft. So even though the domestic market's pushing on increases and they're publishing increases for January, the imported market is still soft. So maybe some potential to offset that. Even with that, the upticks are in the 1% to 3% range. So not a major impact. Obviously real money, but not going to drive things out of control. As for the market, they are seeing that margins are starting to rise given the robust market. So I think a lot of speculation around this and maybe a slowing of volume was that margins would decrease, but their feel is they're starting to rise. And Kevin, you can maybe comment on that, except for Houston. And I think we all know Houston's very oil and gas related, so kind of a slowdown there. And then automatic premium time necessary in bids. And that was a question I had for you, Kevin, as well, is like, are you factoring this into bids? And how are your change orders going where you're asking for additional fees based off of COVID? So I guess we'll pass that back to you, Kevin.
Yeah, that's a good question. We're not seeing what we've noticed in some of the RFPs is what is your overtime labor rates? And they're not even asking for standard time labor rates. So it's interesting they say that in there. And DSI nailed it with the Houston market being pretty flat and the overall Texas market, Central Texas and down for us is robust.
Okay, and then on the change order side, how is that going with the owners? Are they open to it, or is it a big challenge to get those through?
No, it hasn't been. These jobs, it's just like get them in, get them up. Let's get this thing open as fast as you possibly can. And the ones that are successful are the ones that can actually do it.
Fantastic. Daniel, do we have any other questions from the audience?
Again, not at this time, Blair.
Okay. All right. Well, with that, we're going to shift gears a little bit more. We're going to have Richard kind of talk about a better built environment. This touches on a few things that AEI was discussing. We've been really studying the healthcare industry and some of the consolidation that may be taking place there. And so with that, Richard, let me give you control of the screen.
All right. Let's see if I can here.
Let's try click.
Yeah, it's not working too well for me at this point. So
Okay.
maybe take it back. Oh, it looks like you might have taken it back. So measuring value and measuring benefit in the built environment is very thorny, very complex. It was something we've been wrestling with for many years and trying to capture it in a cogent manner. And with all the trade-offs that happen, and of course you could see with AEI in their parallel that immense number of trade-offs and just capturing what is our overall goal, how do we measure it, what are the trade-offs, what in fact are the mission and vision of whatever you're trying to accomplish. And so we're coming to a place where we think we are starting to find this ability to grab the visioning pieces and grab some of the major metrics. As you could see with the COVID, at first you don't really understand it, and then as you get into it, you start to be able to grab the major metrics that make a difference, and you start to identify the major processes and policies and the nature of changes that make a difference. And indeed, that's the attempt that you see in this graph here is what are the major pieces to the puzzle that get you where you're going, and within that, what are the individual strategies. So next slide. Interesting that health networks, of course, we've been focused on from day one due to the frontline nature of them, and those systems have gone into major rethink and rework as first the virus hit and impacted their facilities and their surgeries and revenue streams and so on. And so facilities directors have been huddling and addressing the issues and coming back with plans that are extremely far-reaching in terms of the nature of, how many, with respect to ambulatory, how many centers and locations, what are the net effects, what are the effects of telehealth, and what are the benefits and what are the outcomes coming out of that. So just grabbing those individual elements, pulling them forward into these major buckets is a major part of the work of really trying to assess what those actions are and what the impact of the total benefit might be. So next slide. So as we do that, we pull the individual action items and kind of categorize them into the vision and mission pieces and attempt to get a sense of their overall impact, and then just determining what it is we're measuring becomes the order of the day. So for ambulatory, of course, for starters, we're just looking at the facility and the effect on the workforce within that. Health outcomes in themselves is a whole other topic, and we're going to wrestle with that a little bit more. But again, determining the metric, what is the overall increase in savings and benefit in that sector? So that's something that we'll be continuing to dive into over the next month and beyond, so that we can come back with some initial measures and metrics as to where the overall benefits are coming, because that's in fact what we're seeing overall, that what, even though we're going into this crisis and it's very difficult, most of the impetus is to drive towards accelerated change that is going to have an overall total benefit, and we see it really very clearly when it comes to administrative spaces. So next slide. As these facilities look at their office systems and their workers, all of them got sent home. So it's interesting that Big State still had 100% in their offices. In the health networks, everyone's been sent home, and that's pretty much where they're staying. And as they come back, they're going to be coming back to quite a different environment. And we've talked about this in office and commercial spaces in general. So next slide. So again, we're seeing that consolidation is happening, and it's drastic. The amount of space is reducing significantly, potentially in half in the case of health networks. Consolidation again is happening, and the theme is to go to consolidated spaces where amenities are more available and easier to access. And we're seeing absolutely huge numbers, shocking numbers really, in terms of the amount of time that people spend annually, each and every day, commuting to, from, and between work, and the impact of those savings, both in terms of their individual times, but in terms of their wellness. So out of this process, there is more surveys are being done, people are being talked to, how do they work, what are their preferences, all of those things are now on the table, whereas that process would have taken years before. It's happening now in a matter of months, and we're actually seeing that with this consolidation and the amount of savings available throughout the built environment, that in fact these things are going to be accelerators to change in the construction industry. So we're actually seeing that the built environment, if we go to the next slide, the built environment is going to be a very key leg in the journey of getting to both overall global goals as well as sector by sector, through industries, through construction sectors, through construction systems, an accelerated change. And just with healthcare alone, it's 18% of the North American economy, and making improvements in that sector has absolutely enormous effect on the bottom line. So we'll be going through sector by sector, not just healthcare, but across higher ed, lower ed, office sectors, industrial, et cetera, and retail, as we saw a couple of weeks ago, to try to get a handle and try to measure these changes and the potential beneficial outcomes.
Thank you, Richard. It's fantastic information. Daniel, any questions from the audience? Okay.
Sorry,
Yeah.
I couldn't unmute my mic for some reason. Yeah, no, there's no more questions at this time.
Okay. Just Richard, this slide here, I just want to confirm what your numbers are showing currently is with this kind of shift in administrative office space, you're projecting up to $50,000 per staff member per year in terms of benefit.
Yeah, it might be a little early to even call it a projection, but a few simple numbers against a few simple things are yielding big numbers. And it depends kind of on what you weight that at. So one of the issues that we see when we look at the micro is that planners would tend to say that commuting to and from work does not affect the bottom line of their particular industry, but it sure as heck affects the bottom line of individual people, and mostly in their time and how they value that time. And you can, what was shocking from this study within just a small regional network was that if you use 160 hours as an approximate month, there's like 3, 4, 5 months of a year being dedicated to commuting to, from, and between work. And of course, between work affects the bottom line of the networks, but the value and the benefit goes to the individual as well. So just that number alone was so enormous that it seems quite simple to get to an overall benefit per staff that's in the many tens of thousands of dollars. So that's the nature of the study.
That's great. And I think, again, interesting, big states got back to 100% office staff right now. a little bit different than I think a lot of us are kind of amidst right now. So next session, we actually have DIRT joining us, talking about modular furniture solutions. So this ties back to, I presume, what Big State's doing partially in their office. Others are doing in their offices around the country. A lot what AEI talked about is kind of partitioning off some of the office space. So we're going to have them on. We're going to try and talk a little bit about what the true cost impacts are of going to modular solutions. We are going to provide kind of a bid, GMP, what we're seeing from contractors around the country, maybe recap what we saw for 2020. We're going to continue to expand our conversation on, the healthcare consolidation and the total benefit cost analysis. And our next session, when we're going to cover this, is on January the 8th. So everyone, have yourself a great weekend. Thanks for joining us. We will chat with you in the new year. Hopefully everyone gets a good break and enjoys their holidays. All the best. Thank you.
Thank you.